talking about rubella, and this is where dealing with infectious diseases can sometimes send chills down your spine. But the thought of a viral infectious disease during pregnancy can leave an entire family in a dilemma, not knowing whose life should be their focus, mother or the unborn baby. We're going to be talking about one such disease that has left lots of families shattered. It's called rubella. I'm not an expert. If you know what rubella is, join our conversation. Our WhatsApp number is 0555-61034. So in studio, we're going to have this discussion with somebody who is specialized in dealing with rubella. She's going to be telling us about it. Her name is Dr. Nelly Adade. She is a pediatric resident at the Korle Bu Teaching Hospital. And she joins us this morning to tell us all we need to know about rubella and pregnancy. Good morning, Dr. Adade.
Good morning.
How are you?
I'm fine, thank you. Yourself?
I'm great. So before we came on air, you were telling us about how excited you were when you found us on TikTok.
Yeah.
TikTok baby. Say TikTok baby.
I actually was impressed. I found you on TikTok last night because I was just trying to share the flyer on my TikTok page. And then GTV was there. I was like, okay, what's happening? It was quite impressive.
Nice. We are just not on TikTok, baby. We're on Twitter, we're on Facebook, we're on Instagram. We are very interactive, so you can share links, and that's to you as well. Share. The new free to join is GTV Breakfast everywhere. Okay, so Doc, let's start off with first, what is rubella? Let's just begin with the infectious diseases.
Okay.
Especially during pregnancy. Give us a general overview and then we narrow it down to rubella.
Okay, so once a woman is pregnant, your immune system is kind of low. So you're immunocompromised. So you are prone to getting a lot of diseases because by virtue of being pregnant, your immune system is down. So lots of infections and diseases can come in.
Okay.
So being pregnant tends to be quite a very vulnerable state. You are likened to someone who is old because as you age, your immune system is also low. And then with children under 5, their immune system is also low as well because they are still growing.
Right.
So pregnancy is termed as an immune compromised state.
Okay.
So when you are pregnant, like I said, a lot of infections come into play, and one of them is rubella.
Okay.
So rubella is also called a German measles. It's not the same as measles. It's interesting that sometimes people think rubella is the same as measles because the name is German measles.
Okay.
But initially, rubella was thought to be a variant of measles, but then some Germans did some studies and found out that it's not actually a type of measles, it's a different condition on its own.
Okay.
So because the Germans did that, they decided to call it German measles.
Yeah.
Yes. So rubella is also known as German measles, and it's a viral infection that anyone can get. Anyone, not only a pregnant woman, but as I said, because you're pregnant, you are immunocompromised, so you are at more risk of getting rubella. So with rubella, young children are at risk, a pregnant woman is at risk, an older person is at risk, and anyone who has not been vaccinated at all, because we have the rubella vaccine in Ghana. So if you don't have the vaccine, it means you are likely to get the rubella virus because once you are vaccinated, it decreases your chances of getting an infection.
Okay, so is the rubella vaccine, is it given at birth?
So it's part of our childhood immunization schedule. So rubella is given at 9 months and then also given at 18 months with the measles. So ours is MR, so measles rubella vaccine. It comes together.
Okay.
So it's given at 9 months and then at 18 months in our immunization schedule in Ghana.
But that's for babies?
Yes.
Okay, so how would a pregnant woman contract or get rubella? Does it mean that the pregnant woman wasn't vaccinated against it when they were a child, or what's going on there?
Interestingly, the rubella vaccine was introduced in Ghana in 2013. So interestingly, that was when it was introduced into our immunization schedule. So people who were born way before that time, it's likely that they have not been vaccinated against rubella in Ghana. But then
2013.
Yes, that's when it was introduced into our schedule. But then if you've had the opportunity of traveling outside the country, you realize that sometimes the country you're traveling to, they'll ask for your MMR vaccine. That's the mumps, measles, rubella. They'll ask you to bring an an evidence that you've taken the MMR shot. So once you've taken the MMR shot, then it's very likely that you've had the rubella vaccine. So your likelihood of getting rubella virus is very low.
So for people who haven't traveled outside and don't need that requirement and were born after 2013, before 2013,
it's very likely
wow,
that they haven't taken their rubella shots.
Wow. Okay, guys. And so can I walk into any facility?
You can walk into
today?
Quite a number of facilities and ask for your MMR shot. It comes as measles, mumps, rubella. So it's 3 in 1. So
MMR shot.
So measles, mumps, rubella. So you can walk into any facility and tell them, oh, you want to take your MMR shot, and then they will give it to you.
Okay, so people, if you haven't had your MMR shot yet, this is a great opportunity.
But you have to pay.
You have to pay how much?
It depends on the facility because we give measles, rubella now in our immunization schedule, which is free.
Okay.
If you're an adult and you want to get it, you have to pay. So it's like the facilities have contracted the vaccines and they are giving it up at a fee.
Okay. So you go to a facility if you have not had your MMR shot and get the shot at a fee. Depends on the facility. Okay, so now how does rubella present itself? People say it begins with a red rash. Is it true?
So it actually does not begin with a red rash. So it starts because it is viral. It starts like a flu.
Okay, so there's an image on our screen.
So actually, you get rubella by coming in touch with someone who is coughing or sneezing.
Okay.
As simple as that. So you may see someone coughing, sneezing. You don't know what it is. It could be rubella, especially if the person is not vaccinated against rubella. So you would also have the symptoms of having a cough. You may also be sneezing. You may have runny nose. Your eyes may become red. You may have muscle pain and aches, and you may think, oh, I have malaria of a sort, but then it may actually be rubella. So the rash comes in like a week after.
Okay.
So that's when people see the rash and it looks like, oh, this is quite different from what I know. So then they think, okay, so this is when it started, but it's actually started when you have the flu symptoms.
Okay, so now speak to the image on our screens now. When you begin to sneeze, immediately you begin to sneeze, should you start looking out for rubella or runny nose? And these times too, when a lot of people are sneezing and coughing, and it's everywhere.
It's everywhere. So you know, COVID also presents like this. So quite a number of the viral infections present like this.
Okay.
So it will be difficult to say that, oh, this is rubella, especially if it's very early. If you're having the coughing, the sneezing, you're having the body aches, you may have a sore throat. So it will be difficult to tell that it's rubella until you begin to have the rash. And then when you have this red rash on your skin, then it may tell you that, no, this is off. Because COVID does not usually come with a rash. Right. And then you may now wonder, what's happening? So when you've had the flu-like symptoms and then you have a rash, you need to visit a hospital, because you may be having rubella. Wow.
Okay, to a pregnant woman, for a pregnant woman who has contracted it, already a pregnant woman is presenting so many symptoms.
Exactly.
Today it could be this, tomorrow it could be that. And so when does a pregnant woman know that, Charlie, I need to go and do a check?
It's the same with everyone. So when you have the flu-like symptoms, you may say, oh, I'm not sure what this is, so let me wait the time out and see what it is. But once you have the rash, once you begin to see that you're having this red rash all over your body, it may be itchy in nature, and then you have to visit the hospital.
So the red rash is the telltale sign. That's a red alert for you to rush to a facility.
Yes, because I'm saying that because quite the early symptoms can be it could be anything.
Okay.
And you may not be sure of what it is. You may go to the hospital and say, doctor, I'm coughing, I have a flu, I'm sneezing. The doctor may say, oh, it may just be a viral infection, so
right.
let's wait.
Okay.
Yeah.
Okay, so to the pregnant woman who has contracted rubella, how dangerous is it for the woman and the unborn baby?
Okay, so the earlier you contract rubella in pregnancy, the more risk you carry to your newborn. Because
what's the earliest you can?
So the earliest, I mean, in the first trimester.
Okay.
Because at any point in time, you are vulnerable. So you could pick up the bag from anyone at any point in time. So if you have it very early in the first trimester, your risk of having complications or your newborn having complications is high as compared to having it in the third trimester, because usually in the third trimester most of the organs and the systems have already been formed. But in the first trimester, when the heart is being formed, the liver is being formed, the brain is being formed, a lot of things are being formed. When you contract rubella, your child is more likely to have complications at birth.
Right.
Yes. So the earlier you get it, the more the risk of having newborn complications is high, and then your risk of having stillbirth is also high. So you may be pregnant and then suddenly you lose your baby. So you may have a miscarriage. You may even miscarry your pregnancy before the first trimester ends. You may have a stillbirth. You may be there and then you are not feeling fetal movement and then your baby is dead, or you may go into preterm labor. So rubella infection is actually one of the causes why someone will have a preterm labor and give birth prematurely.
Okay, so Dr. Adade, does this mean that a lot of people do not know about rubella? They don't even know about it. They'll probably think they have a cold. So does it mean that for most women who have probably had miscarriages or had stillbirths, they might have contracted rubella and they didn't know?
It's very likely.
Wow.
It's very likely. But the good thing is, because from 2013 till now, if you look back, that's about we are in 2023, so that's about what, 10 years. Yes. So from 2013 till now, a lot of people have been vaccinated.
Okay.
So it kind of provide what we call a herd immunity. So it sort of shields a lot of people, because most people, and then we have people who have traveled outside the country, they've taken their rubella shots, so it sort of shields us. So unfortunately, I was trying to actually look for statistics in Ghana, but it was so difficult to find statistics in Ghana, because most of the time we do not keep records of such things. So I found it very difficult.
Isn't this alarming?
I was trying to look online, but the only data I came across said with per every 10,000 births, we are likely to have 6 children who suffer from congenital rubella syndrome, meaning that they got the rubella from their mother and then they are suffering complications from that. So that was the only data I was able to come across online. It will be difficult to tell, because maybe other facilities are having data that they haven't shared out yet.
Wow, but isn't this alarming? If there's this viral infection that is causing maybe lots of miscarriages or stillbirths, and if they are recorded in these facilities, do we not, I mean, is there not like a pool where all this is, where people
maybe
can just have access?
Yeah, maybe I didn't set hard enough, because I didn't go to the Ghana Health Service website. So I can't say that maybe I exhausted all the platforms.
Okay. So assuming a pregnant woman catches this infection maybe in their final trimester, is there a possibility of actually having the baby alive, but the baby contracting?
Yes. So you are likely to have your baby alive, but then your baby may suffer complications from you having rubella, because you are going to transmit the virus to your baby. And when it gets to the baby, your baby will come out with certain disorders that we would see when the baby is born. And then some of them would also notice them as the baby is growing.
Right.
So you may give birth to a child. So the complications, may have a child who you may born with may come out with a cataract. So we would see that. And then so with a pregnant woman, the pregnant woman could have a stillbirth or miscarriage. The child could have a lifelong disability and a severe birth defects. So the birth defects, one of them could be the cataract I was mentioning, or they could have heart problems, especially if they were born, if they contracted the virus very early in the pregnancy when the heart was still being formed, they could come out with heart defects. As they grew as well, they could have hearing problems as well. So you may not know why your child is having challenges hearing, or is having is sort of deaf. It's likely that you had rubella when you were pregnant, and then your child is suffering from congenital rubella syndrome.
Wow. So can a pregnant woman take the MMR shot or the vaccine while pregnant?
So no, it's not advisable, because the virus is made, so the vaccine is made from a weakened form of the virus. And as I said, once you are pregnant, your immune system is already down. So because it's being made from a weakened form of the virus, it's not advisable that you take the MMR vaccine when you are pregnant. You could take the MMR vaccine, say 2 months before you plan on getting pregnant. So the interval should be at least 4 weeks before you get pregnant. So if you know you are trying to conceive, and you and your partner are talking about getting pregnant, you could take the MMR shot at least 4 weeks before trying to get pregnant. And then, but whilst you are pregnant, no, you can't take the MMR vaccine.
Wow. Okay, so once you're infected, is there a cure?
Unfortunately, like most viruses like HIV, there's no cure. viruses are very interesting organisms. They tend to change their nature as and when. So when you're trying to find a cure, they change their nature. That's how viruses are. That's why it's difficult to come across cures for viruses. But then the symptoms are managed.
Okay.
Yes, just like, and most of the time, because it's a self-limiting disease, meaning that it will go on its own. It's a viral infection.
How long does it take for it to go?
Everyone is different. Your immune system is different from someone else. So it'll be difficult to say that it will take a week or two. But then there's you are likely to be very infectious or contagious. I mean, passing it on to someone a week before you have the rash. And then a week after you have the rash. So a week before you have the rash, you are likely to spread it around. And then a week after you've had the rash, you're also likely to spread it around. But after that, you're fine. Your risk of spreading it to other people is very low. So when you see that you have the symptoms and you have the rash, please try and protect those around you. So stay away, isolate yourself from people. When you go to the hospital, yes, we may do investigations to confirm that this is rubella. But once it is, so when you have pain, we'll give you paracetamol. When you have a fever, we'll give you an analgesic for you to get better and all. But we are not going to give you treatment that this is for rubella. No, we'll give you a symptomatic management. You manage your symptoms.
Wow.
Yes.
So in managing those symptoms, do you take drugs daily? Is there a prescribed drug that you need to take?
So it depends on the symptoms you are presenting with at the time. That is what will determine what will be given to you at the hospital.
So does it mean that maybe in the first week of contracting it, you present serious cold symptoms, you'll be treated for that?
Yes.
The second week, you present another symptom, you'll be treated for that?
Yes.
And does it go on for life?
No, so
until
it's not lifelong. It takes a couple of weeks and then you are fine.
Okay. What's the earliest that somebody has been treated that you know of?
I haven't seen anyone being managed for rubella. It's not something people really come to the hospital with, and especially because I'm in the pediatric units, I've hardly seen children coming with flu and all of that we thought it was rubella. Yes. Okay.
So what happens if rubella is left untreated in a pregnant woman?
So if it's left, so as I said, it's usually self-limiting, but because you are likely to pass it on to your child, that's when your child will suffer the complications of you getting the infection.
Okay, so there's an image on our screen now. Maybe you could speak to it.
Okay, so this is just basically, so the one on the left side is talking about the congenital rubella syndrome. That is what the child may suffer when the mother contracts rubella in pregnancy. So there's deafness, there's cataracts, there are a lot of heart diseases, different heart diseases you could suffer. The child may suffer problems whilst learning at school. So that one will come out later when the child has started school.
Okay.
So the child may have some intellectual disability. The child may have issues with the liver or the spleen as well.
Oh, that's a lot for the little child.
I know.
So how do you get cases often with children?
It's not common.
Okay.
It's not common.
Okay. And so well, we don't have the statistics, but maybe next time you can come on and give us the statistics for the previous years.
Yeah.
Okay. So by mode of transmission is just, let's run us through it again so that people are aware.
So the mode of transmission is coming into contact with someone who is coughing and sneezing and has the virus. So the person has the virus and then the person is coughing and sneezing. Just the droplets being released into the atmosphere. When you are by the person, you could get rubella.
So should we wear a mask all the time?
The mask is safe.
Wow, guys.
But if you know you have been vaccinated, like I know I have been vaccinated, I have taken my MMR shot, my risk of getting rubella is very, very low. My chances are very, very slim. So if you are coughing, and I've taken my COVID shot as well. So if you are coughing and sneezing, well, I know I'm sort of safe.
So you're gonna, guys, if you haven't had your MMR shot, you can go to, are there particular facilities that we can go to get the MMR shot?
Oh, quite a number of facilities. So I know the Greater Accra Regional Hospital, they give the rubella shot. I know about Adabraka Polyclinic, they give the MMR shot. I know of private hospitals like Akai Clinic. That's where I personally took my, I'm not advertising for them, but that's where I took my shot some years ago at Akai Clinic. Quite a number of private facilities actually give the rubella shots. Okay.
So Dr. Adade, where can we find you on social media for more interaction?
So my social media handle is the PediaDoc.
That's nice. The Paediadoc everywhere.
The Paediadoc. So on Facebook, I'm on Facebook as the Paediadoc or Nelly Adade. I have 2 accounts on Facebook, Nelly Adade and then the Paediadoc.
And on TikTok, baby?
On TikTok, baby, it's the Paediadoc as well. On Instagram, it's the Paediadoc as well.
Okay.
So it's THE, then the hyphen, then Pedia, PAEDIADOC. So the Paediadoc.
Okay, look, so if you were to put out a tweet or a message on TikTok today on educating us on rubella, what will your tweet read? Or what would it say?
You're putting me on the spot. Oh, my tweet say, get your MMR shots today.
That's it, simple as that.
As simple as that.
Okay, guys, and this has been our conversation on rubella and pregnancy. If you haven't had your shot, anybody at all, if you haven't had your shot, go to a medical facility and get your shot at a fee. We've been having this